Our next speaker is joining us from Kigali in Rwanda, I believe. Is that correct? David Saladik, if that's not the correct way of saying it, I apologize. But David is an architect working on the front lines of infectious diseases and construction of infrastructure in collaboration with communities around the world. David, would you like to say more about your work?
Sure. Thank you, John, and hi, everybody. I'm very happy to be here today. Yeah, I'm an architect and principal with Mass Design Group. And one of the core goals of our organization, Mass, is to use design and the built environment to promote health and improve lives fundamentally. So we work on a lot of healthcare projects and partner with communities and governments around the world working on these issues. And perhaps because of this, throughout my career at Mass, I've often found myself at the epicenter of outbreaks. So after the earthquake in 2010 in Port-au-Prince, I was living there working on a tuberculosis hospital for patients with multi-drug resistant TB, MDR-TB, and witnessed the emerging cholera epidemic in Haiti. And then I was in Liberia in 2014 and 15, working with the Ministry of Health on a maternity and pediatric hospital, and saw the Ebola outbreak happen firsthand. And of course, now there's COVID-19. But I think, for me, what's so different about coronavirus is that it's, no longer place specific. This is not a Wuhan problem. This is something we're all experiencing. It's a pandemic in a way that I have not seen before. But I think in each of these cases, there have been design interventions and spatial solutions to help stop the spread of the disease, like designing for adequate ventilation and air changes per hour, or organizing the flows of materials and people, for example. And I think in almost all cases, we have seen the use of isolation in some way or another as a tool. And so, for example, with MDR-TB, patients stay in isolation rooms when they're receiving their treatment. And with cholera, the goal is really to isolate human waste and treat it to prevent reinfection. During Ebola, there were ETUs, these Ebola treatment units that popped up to isolate and treat entire groups of suspected and confirmed cases. But with COVID-19, I think we're seeing isolation and social distancing really at an unprecedented global scale, and it's impacting our communities, our cities, our countries. As John just mentioned, I'm in Kigali, Rwanda, and I think the government has been incredibly proactive here since recording their first case a week ago. They've shut the airport down, they've closed all the borders, they've restricted travel within the country and ordered everyone to stay in their homes for 2 weeks, except to get essentials. And I think, that our collective new reality of social distancing and social isolation, while I believe, very good for the public health, can leave people feeling really helpless or depressed often. And there can be a fear of what's to come, or guilt over our inability to act. And I think, the message that I want to try to give people today is that I think one question we've been asking really our team at Mass and our partners and our clients is, how can we kind of be on the critical path of doing good? And what can we do to help? Is there one thing, however small, in this time that we can do right now to make a positive difference? And I think this has been a big help within our organization to help people take their minds off of this bigger global problem and concentrate on something local that we can try to influence, maybe have a little control over, or help to improve. And I think an example of this for us popped up really overnight in Boston, which is our other office is there. We have one large one here in Kigali and another office in Boston. Was working with one of our partners, Boston Healthcare for the Homeless. They're one of the largest healthcare providers in the city. And they were going to get emergency tents up and operational in less than 48 hours to isolate and treat cases within the homeless community. But of course, if you think about tents, these can be potentially terrible places to put coronavirus cases. They can be very dangerous hubs of infection for healthcare workers or suspected cases, people who might not have it. But I think, we were able to work with them very quickly, focus on this, and kind of bring some of our knowledge of of design for infection control from these other places and these other situations to think about how to make these tents safe for people. So I think you don't have to be a designer or an architect to do this. I think we've heard some examples of how to get involved from the other panelists already. And, I think everybody can do something. I think whether it's, checking in on people in your network, maybe they're elderly, maybe it's going on a grocery run for people who are in at-risk populations who shouldn't be doing it. There are ways that we can all pitch in. So I guess I'll just leave everybody with this question again of that I think we should all ask ourselves, what can we be doing to be on the critical path of doing good and helping, even if very local and very small. So thanks very much.
Thank you. Thank you, David. Asby, you had a question for David.
Yes, David, this is really interesting, and yeah, it's inspiring work, and I'd like to see more of it. One question I have, it's something I think about myself as well, because I also work in design. What ways do you see to address the psychosocial effects of a crisis like this, in addition to the physical and medical ones?
Well, I think, yeah, very, very good question. I mean, I think a lot of the work that we do happens over very long time horizons. You don't build the hospital overnight, although they have done that in China in 10 days. A lot of the long-term infrastructure we work on takes years to design and build and plan. And I think, I've seen people coming together in very different ways over the last week. I mean, this is a great example of it. I can't, imagine that I would be spending so much time on Zoom or on Slack or on different ways of connecting digitally with people. But, that seems to be one way that we are coming together, reconnecting with family, friends, with colleagues, trying to keep spirits up, and I think focusing on the mental aspects of connectivity, even though we're not able to physically connect. And so I think that's one thing I'm seeing even more than before. I mean, I personally went through a phase of over the last year or two of, I think, pulling away from social media, really trying to kind of break our habit of using it all the time, trying to step back from it. But I've seen a lot of people coming back to it in this really difficult time, using it in new ways, being really helpful. But my hope is that when we get out of this and we can actually all come back together in physical space, that whether it's design or whatever profession you're in, we look at those spaces of gathering, those spaces of collectivity, and I hope that we can, whatever tools are at your disposal, we can think about hopefully putting some of the very divisive, dividing issues behind us, and hopefully looking at how we can come back together stronger than we were before, and maybe build on some of the kind of collective good that we're seeing coming out of this, with all
Also
of
going to
the
add
toilet
that
paper hoarding aside.
There's a beautiful psychological layer to this as well. The mental health in buildings, or the physical health and the interconnectedness, keeping that connectivity with and amongst people. We've got a session that's coming straight after ours in Germany that's going to be looking at this too. So to our viewers, please stay on for that. I'm also going to ask our viewers to join in and add your comments and questions. We're now going to move on to our next speaker. David, thank you for yours.